Hello, my name is Megan Hudson, and I will be doing a case presentation today on Maggie Jones for assignment 4, Applied Clinic Theory. A brief introduction about Maggie Jones is that she's a 45-year-old woman. She suffers from a rheumatoid arthritis. She is currently seeing a specialist and is coming in today because she doesn't like the stain on her teeth. Maggie is nervous about treatment. She does not like scaling or probing, and she smokes half a pack of cigarettes a day. She does present with dry mouth and also complains about a bad taste, as she does have several overhanging restorations and they are very old and will need to be replaced. She is missing her wisdom teeth, her second premolars, and her first molar on her quad 1, and she also has a furcation involvement on her 3-6. Recession was found on her first premolars and her canines, and there was generalized inflammation and bleeding on probing. Her last dental cleaning was 2 years ago, and she does have a moderate buildup of supra and subgingival calculus, and she has a high plaque score due to her limited dexterity caused by her systemic disease. Maggie's blood pressure is 138/88, and she does currently take a multivitamin, Advil, Humira, and methotrexate for her pain caused by her rheumatoid arthritis. So because of Maggie's high blood pressure, we have to send a medical consult letter. And a medical consult letter is a letter that we send to physicians or specialists that for clients that may have contraindications to non-surgical periodontal therapy. Some of these things would be the subgingival probing, any treatment that causes gingival bleeding, scaling, and root planing. So after we complete a medical, dental, and social history, we should be able to have enough information to decide on whether or not we would need to send a clearance letter for the client. And as for Maggie, we did find that we needed to send one because of her blood pressure reading and due to her rheumatoid arthritis. So this is just the medical consult letter that was sent out for Maggie. So according to the CDHO, blood pressures readings with systolic of 130 to 159 and a diastolic of 80 to 99 need a medical consult letter before treatment. So because Maggie does have a blood pressure reading of 138/88, we need to send a medical consultation before we complete any care. So we also need to follow certain steps during the appointment when it comes to a high blood pressure reading, and this would be that we need to recheck her blood pressure after 5 minutes. We need to continue dental hygiene care and procedures as required, and we need to give the client a written note of all of her blood pressure readings so that we can refer her for her medical consultation. I just want to quickly touch on rheumatoid arthritis, as it is an autoimmune disorder, and because the CDHO's best practice guidelines indicate that any client with an autoimmune disease is required to have a medical consult letter before proceeding with treatment, we need to make sure that that was sent for her rheumatoid arthritis. So in Maggie's case, a medical consult would need to be done because of her BP and her rheumatoid arthritis, and that once the medical clearance is obtained and we are given the okay, we can proceed with treatment for Maggie and ensure her oral health is properly maintained and taken care of. So that concludes my presentation today. I just wanted to take a moment and show you an example of a healthy joint. So this would be a normal joint in health where there's lots of cartilage supporting tissue. This is an ideal. Well, this over here would be osteoarthritis, which the cartilage has been broken down and the joint does not have a lot of stability. It is kind of in a moderate state of disease. And when it has entered rheumatoid arthritis, it is complete inflammation around the joint. The cartilage is gone and unable to be repaired and is now in severe disease stage where medical intervention is required. So rheumatoid arthritis can affect all joints, which include the TMJ as well. So this is why we need to take care of Maggie, to make sure that we are being proactive in her healthcare instead of reactive. Thank you.